I'm going to try to explain to you briefly the who, what, where, why, and how of the lymphatic enhancement therapies that we do. And I like the light being out because the program will show up better, and so will I. So let's go ahead and get started here. So what is LET? Well, it's a unique, gentle stimulation of the lymphatic system, and it uses the lattice fusion device, which is this machine here. Those wands, I call them, that you see are these. And in here is incorporated light, sound, you probably can't see it, vibration, see that? Can you see? And microcurrent. The microcurrent that's in this is the same as if you had socks on and scooched across the carpet. It's static, okay? Also, the lattice fusion is used in conjunction with a manual technique which is known as touch and directional release. It's not a massage. It's a touch and release, okay? So what does LET do? Well, it improves the lymphatic system function. It facilitates pain reduction, facilitates the healing and edema, which is swelling, pre and post-surgical, post-injury. It supports tissue detoxification and supports and stimulates the drainage of congested areas of the lymphatic system, which all this will become clearer as we go. As you know, reduced congestion facilitates a decrease in inflammation, okay? Which in turn facilitates a decrease in pain. So everybody here, I'm sure, has at one time or other had a swollen joint or swollen something. When the swelling starts going down, the pain decreases. So what is the lymphatic system? Now that we know what the therapy is, the lymphatic system, it's a system of vessels and organs that drain protein-rich fluids. Protein-rich fluids in the body are physically sticky. They can be sticky. And this includes waste products and toxins from your entire body. It also provides immune system support. Immune cells reach all areas of the body, which means the lymphatic system reaches all areas of the body. The lymphatic system and the immune system are kind of like twins. And what happens is when we start clearing out your lymphatic system and get it to drain in the right direction and get it to drain the way it's supposed to drain, your immune system gets healthier and stronger. So that's what we build on. We first look for change during our therapies, and then we realize that the shift has taken place. You are going to actually feel the difference. And it can be as subtle as having to get up in the middle of the therapy to go empty your bladder. Okay? It can be very subtle, and other times people experience something much greater. Okay? Their headache disappears during therapy or whatever. They migrate into spaces between the blood vessels and the tissue cells and return through the lymphatic vessels. Again, lymphatic vessels go from your head to your toes. It drains from your feet up. The only thing that moves lymph is movement. And if you think about someone who is, they don't move around much and they sit a lot, their feet, ankles, legs will swell. Even on an airplane, right? You're sitting for a given amount of time, your fluid is not moving. You get up, you start walking around. It's a little difficult at first because of the swelling. You're not moving as well as you normally would. But once you start moving, you're moving the lymph up, and it's draining, and it's going through your organs and out of your body. Okay. So what does the lymphatic system do? Again, it transports protein-rich molecules, immune cells, toxic materials from the limbs and organs to the lymph nodes, the liver, the spleen, your tonsils, your adenoids, and your appendix. All through your body. Again, it's a whole system. So how does it do that? Well, it does it through what we call watersheds. Okay? Your lymphatics don't drain up and down. Okay? They drain in the direction of the arrows that you see. This section, which is the left, right, drains the whole body except for that area right there. And that area is drained into that area to be able to go into where it's supposed to drain in, where you swallow down. Basically, that's why you swallow. You swallow all these things out of your system. It goes into your gut, and it goes into your bowels and your bladder, right? So you can see how intricate it really is. And you have lymph nodes all throughout. So a perfect example would be what's happened recently with all the rain. You've had roads closed because the water had nowhere to go, so it just puddled up, right? Same thing with the lymphatic system. If it's not draining properly, it will find a place to go, and which is normally where your swelling will come from, which is going to cause you pain, right? So what we do is we open up those areas, we take what doesn't belong and put it where it does belong, right? And you can see, just in the face, all these different areas that the lymph drains. So how does LET work? It's the placement of these instruments on the skin that stimulate the superficial lymphatic channels. We have a lot of lymph in our skin, okay? And you can see the wands that I just showed you, the heads, right? And also in that picture is this. This, okay? And these contain the same equipment, the light, the sound, the vibration, and the microcurrent. They're on different frequencies and different levels. So they're doing the same thing in a different way. This is followed again by the light, manual touch, and directional release. Why do I say directional release? Because if you're working on a lymph node in somebody's neck, you don't want to push it up, you want to push it down. Why? Because it drains from the feet up, so we have to clear everything above that. If your ankle's swollen, it's no good to clear your ankle if you have a blockage in your lymph nodes in your groin. Make sense? So we have to go up, go down, so they can come up. Okay. It works with the sympathetic and parasympathetic systems. Bottom line, your sympathetic nervous system is what keeps you moving forward, right? Your parasympathetic is where your healing is. All right, so we have become a very sympathetic peoples. In other words, without realizing it, we are constantly making ourselves move forward and ignoring the parasympathetic system, which is your healing system. So the parasympathetic is constantly working, healing, trying to keep us moving forward, but it works especially well and especially effective when you're resting. So, case in point, if you're not resting, you're not healing. Okay? Now again, thank you. So what is the treatment? All right, well, the effects can vary from person to person. Some experience overall relaxation and rejuvenation. Some people fall asleep during the treatment. Some report feeling energized. Some report feeling deeply rested. I've had, on occasion, patients will say, I feel cleaner, I feel lighter, I feel energized, but I would just like to mellow out. I feel mellow, but I want to go do something. So everybody's different in the way it's going to affect you, but it will affect you in a positive way. There's typically an increase in bowel and bladder activity. The bowel movement will be bigger, and the bladder activity, there may be an odor, there may be a color change, and why is that? Because we have moved all these toxins that's floated around in your body for years and not knowing where to go, and we've moved that. And we try to keep these treatments to the point where you're getting the good effect, but we don't want to overwhelm your body. So if you take years, right, however old you are, and you think, well, you know, this didn't work, but you've only been here for an hour. Right? It really does work. They accumulate in your system just as the stress accumulates in your system. So what we do is not only try to make you feel better in the present, but continually keep you moving away. If you do one treatment for an hour for 6 weeks, that's only 6 hours, as opposed to however old you are, or whatever your health is. So at the end of the 6 weeks, we sit down, talk, you know, where was I when I came in, where am I now, where do I want to be? So then we move out and say, well, let's try every 2 weeks, let's try every 3 weeks. We have patients that come in like every 3 months. Not because they need to come in, but because they enjoy the treatment. So they've gone through the gambit, and they can maintain their treatment for 3 months at a time, right? So some people get, you know, they finish therapy, they come in every couple weeks, they're doing great. They don't feel the need to come back. Some people do. It's always good to have a little touch-up now and then. So you have to commit to the fact that you're going to hydrate yourself by drinking a sufficient amount of water to assist in the flushing of your system. So as I said, we have moved all this stuff out of where it is, put it where it's supposed to be, and now it has to get out of your system. And the only way to do that is water, water, water. And we're talking about 8 ounces of water an hour for like 4 hours. And for the next several days, you should always increase your fluid. Okay, so who is a candidate for LT? Anybody that suffers from any of these things. Now, I want you guys to read the list and raise your hand if you've never. That would be an easier way to do it. Okay? People who should not get LET, there's 2 categories. One is if you have had a recent blood clot, or you are less than 6 weeks away from that under medication. If you are over 6 weeks, I guess would be a better way to say it, from being diagnosed with a blood clot, and you are taking your blood thinners, and your doctor is secure with your INR numbers, then we can do the LET. People who are currently suffering from congestive heart failure, right? Once you've gotten past that point, your medications are, and you're feeling better, then we can do that. These are it's the same treatment, but it's just done for a less period of time, and it's much more gentle, because you don't want to remove a lot of stuff. It also helps with cancer treatments. The only time you wouldn't want to do the LET is if you're currently taking chemo, and for whatever reason you have been put on antibiotics. So you can take your antibiotics, but you have to wait for 3 days after you've taken your last one to do this. Why? Because it's very gentle, but it's very effective, and we can actually move that antibiotic out of your system, and you don't want that, right? So it's better just to wait for a little bit.
In the headaches, is that migraines as well as regular headaches?
Yes, actually I thought migraines were on there, but yes, headaches, sinus congestion and pain, which we've all suffered from recently.
But I just want to step in. This isn't a treatment for disease.
No, it's not.
To help you feel better. People with migraines who have this done notice an improvement. So that's an important thing to always remember.
So as Dr. Ross has mentioned, this definitely is not a cure for any disease, okay? But it can help you feel better, help you feel well, okay? Yes?
I don't see the allergies though.
Does it help your allergies? It will help allergies, symptoms, the symptom of the allergy. Okay. We have 3 trained and certified providers. So it's Brittany Sellers, Miranda Vinson, and myself. Where and when is it done? It's performed in a private office setting in Suite 202, which is right down the hall. Treatments are by appointment only. They are available Monday through Friday, every other Saturday, and appointments are booked through Dr. Ross's front office staff. Okay? Okay. LET is an integrative component of your doctor's therapy. It is not a substitute, right? 3 things you need to know. 1, the first thing that's going to happen is you're going to have an overall feeling of well-being. Okay. The second thing is you're going to start being well. And the third thing is you're going to become as well as you can be. Okay?